A very good morning to all my subscribers. Doesn't matter where you are, if it's good evening, good night or morning, welcome to my channel. I am Dr. Paramita Ghosh. I'm known as Doc NatureLover. If you're new to the channel, please do not forget to subscribe. I do videos on lifestyle, medicine, and a lot of other things including makeup and beauty and fashion. Those are my passion. I want to talk to you guys about something from the heading of the discussion, or you already know that we are going to talk about diabetes, intermittent fasting, and the impact that weight gain or weight loss has on this. So these three terms, diabetes, intermittent fasting, obesity, needs to be explained first. So this is a topic very close to my heart. I probably see 90% of my patients have diabetes. It is not just an epidemic, it's a tsunami coming your way. And the more and more studies that are going on, we have evidence that there is actually a lot of people who have pre-diabetes who are going to become diabetic in the next 4 years. In 2015, the number of patients diagnosed with diabetes in the United States was 9.4 million. You heard it absolutely right. 9.4 million people were affected with diabetes. I'm not making this up. This is on the websites. You can go and check it. The tsunami is coming our way. The more important thing that is happening in diabetes is we have about 90 million people who have pre-diabetes who are going to become diabetic. So think of those people who are going to become diabetic in the coming years. So we need to fight this disease. However, the fundamental reason that people get worsening diabetes is because the main structure of diabetes is it's a disease in which the insulin level is high. It's a high insulin level disease. Your insulin level goes up and your body does not respond to the insulin and causes resistance. If you guys have diabetes, pre-diabetes, or you're trying to lose weight by any means, to look better, to feel better, to get your blood sugar under control, to get your cholesterol under control, please keep on watching till the end of this video. This video is very close to my heart because this is what I do for my living and I'm absolutely passionate about it. The first and foremost thing I want to mention is please comment below. If you have any questions on specific things on diabetes, I'll be able to answer because I want to do a question and answer session on diabetic disease. However, today I want to start off in explaining what diabetes is, and I personally do not think that the patients are told by their physicians in details about what diabetes is. So majority of the population does not know diabetes. They take a medication, they take a prescription medication without even knowing what diabetes is and how diabetes affects your health. So that's very important. As a physician, my general rule, I know I have a lot of patients on diabetes and we are seeing a lot of patients, but at the same time, to me, the most important thing for tackling diabetes is when you walk into your doctor's office, please take a moment and ask them, can you tell me what diabetes is? And can you explain to me what this medication is going to do for me? Because we are not treating the disease. We are deeming it as a chronic disease because we are not treating the disease. We are treating a symptom, which is blood sugar. However, we are going away from treating the disease. I'm going to give you a common example. For example, say take an alcoholic patient. If you want this alcoholic patient to give up alcohol, what do? You have to stop the alcohol, giving the alcohol to the patient. the patient is going to have symptoms from alcohol withdrawal called delirium tremens. We all know they become shaky. So you are trying to affect. So by giving more alcohol, you are trying to make the alcoholism worse. Diabetes is exactly the same. What are we doing? Once the oral medications are failing, we are giving them insulin. It is a high insulin state. We are talking about type 2 diabetes. Type 2 diabetes is a high insulin state. The body is not responding to the insulin. The body is resistant to the insulin. What we need is something that is going to stop the insulin resistance. And how are we going to tackle that? The more insulin you're going to give to the patient's weight goes up, and it's a vicious cycle. So basically, at the end of the day, gradually you are progressing the disease. So year 1 you have one medication, year 2 you have 2 medications, then you're gradually going into insulin, increasing the types of insulins, short acting, long acting. This is not what we are treating. We are not treating the insulin level that we want to treat. We are treating blood sugar. The doctor says your blood sugars are doing well. Yes, but on 5 medications. The disease is not doing well. My blood sugar is doing well. And we are giving more insulin to the patient and making them gain weight. We all know that insulin makes people gain weight. So how are we going to tackle this tsunami of diabetes and prediabetes? In the last 5 years of my life, I have myself lost 70 pounds. I definitely have followed some protocols and something that has made my weight loss be permanent, or I'm able to maintain, because a lot of times we are seeing patients are reducing the calories, trying to follow a low-fat diet, but at the end of the day they are gaining back the weight. It is not easy to keep that weight off. You might be able to lose weight, but you're not able to get the weight off. This topic of discussion is going to be divided into few sections, because I do not think I can end this talk on one sitting, because it's a lot of things that I have to go over. But I want to give you home a message that we are going to talk about insulin resistance and how we can combat diabetes, how we can make the diabetes go away. I have patients who are on 2 or 3 medication. They come back after, and I almost talk to them. I'm literally talking to them. I'm like, no matter what medication I'm giving you, sir, madam, anybody of my patients, they know that I need to see their diet chart at the end of the 1 month. What is going on? What are they eating? What are the choices they are making? I bring them back in 2 weeks to talk to them about diet. I am not shying away from talking about the main points of diabetes. They know very well that I will not be continuing to just give them medication if they are not bringing their blood sugar numbers, if they are not bringing their food journal with them. They bring the food journal, and I'm seeing that they are doing things. They are restricting their diet, they are doing many things and getting the weight off, and the diabetes goes away. So how come a chronic disease goes away with weight loss of 50 pounds, 60 pounds, 70 pounds? I was pre-diabetic. How did my diabetes go away? My hemoglobin A1C went down to 4.8 after I lost the weight. So how is that possible? That a chronic disease that we think should be progressing, when a patient loses weight and is able to maintain that weight, is going to say that, no, I don't have diabetes. My blood sugar is normal. My insulin level is normal. So before going to the next phase, I want to draw your attention to this chart over here. And I'm going to bring this chart closer. Understanding type 2 diabetes will need what is going on here, what is going on in the body. This is very, very important. This is something that I keep in every patient room. Understanding type 2 diabetes. So this is our body. This is the heart. This is the liver. There is the stomach. And then we have pancreas, large intestine and small intestine. We are concerned about this pancreas where insulin is made and released. So this is a particular cell of the pancreas. This is a cellular view of a single cell of the pancreas. So the pancreatic cell consists of 3 types of cells. This is the 3 types of cells. Alpha cell right here, and then the beta cell right here. These are normal insulin producing pancreatic cells, the alpha and the beta cells. And then we have the normal insulin producing cells. They are the beta cells cannot produce insulin needed to help cells convert glucose to energy. So do you see that these are looking different from these type of cells? So the beta cells release the insulin, and these beta cells are not able to release insulin, which is what we need from the pancreas. Because once the insulin comes out, then we can have a process by which the sugar is going to be taken up by the liver. The next thing I want to focus on is this is a normal body cell and a diabetic body cell. So on this side is the normal body cell, this side is the abnormal body cell. The insulin attaches to the cell receptor and opens the door so that the sugar can go inside the cells. And in a diabetic patient, the cell door is closed. Glucose is not able to go in through the receptor, and instead of going inside the cell, it's going to the bloodstream. The glucose is moving inside the bloodstream. So the patient is having high blood sugar because insulin state is not occurring. In type 1 diabetics, there is a problem because the type 1 diabetics do not secrete enough insulin from the pancreas. But in type 2 diabetics, which is very, very important, the cell door is closed. So the body's reaction is make more insulin. Let's make more insulin, but the insulin is not working. It is resistant to the cell is not responding. The body is insulin resistant. So this extra amount of sugar in the body, what does it do? It goes on and causes what? It is going to cause eye disease, heart disease, stroke, kidney disease, vascular disease, nerve damage. So in order to understand this process of insulin state, it is very, very important that we understand this stuff. So basically this is a normal cell and this is an abnormal cell which is not able to take it. In order to treat the disease, what we need to do is we need to treat the insulin state, and that is very, very important. Why the insulin state? So that we can lower the insulin resistance and we can lower the insulin level. So there are a couple of drugs which I'm going to go into on my next video presentation. Today's topic is how can we reverse this process of diabetes from it being a chronic disease to making it under control. This can be done just by diet. And it is very, very important that we understand this process by which we can become a diabetic patient who used to have high blood sugar. They are being converted to a non-diabetic. If we can do that, then we will be able to defeat this disease, because this is a disease which is horrific. Heart disease, stroke, ophthalmologic conditions, food problem. As you progress and the more and more medications you're taking, gradually you're going to need insulin at some point in time, and then there is no return from there. So we have to do something about what we are doing is dietary changes. If you tell the patient, please starve, the patient will not be able to do this. So we need to be realistic in the goals and what we are telling to the patient. So it's very important for all of you to understand this, that we have two methods. One is you can restrict your carbs. If we do not have sugar going into the cells, then we do not have sugar. So there is no sugar going around. Insulin resistance goes down. However, it's not possible to not be starving and just eat proteins and fat. And another thing is, even if you are following a keto diet and you're eating protein and fat only, guess what? Protein and fat still gets converted to sugar. So we have to find something that is defeating. That is, I need to mention this, we need something that is defeating the body. In the insulin resistance is being defeated by that. And the method is intermittent fasting. You are going to be able to eat whatever you want. It doesn't matter. Excuse me, please. I was on call last night, so I think a couple of phone calls I'm getting for the callback. So this is something we have to realize, that we have to defeat the body by doing intermittent fasting. The method I followed, I gave this suggestion to a lot of patients, and this is not something that I'm just saying because I want to do it. This is documented in various medical journals. It works. Intermittent fasting works. The way intermittent fasting works is because when you do intermittent fasting in all our religions, no matter Buddhism, no matter Christianity, no matter Hinduism, in the Muslim religion, all religions have practiced fasting. Our ancestors have always done fasting. Why do we say break fast? Because we are breaking the fast. So this concept of intermittent fasting was known years and years back. It's just that we did not understand, or we did not want to follow it. If you want to be eating everything, if you want to not give up your life, what you need to do is you need to go to intermittent fasting. There are no set methods of intermittent fasting. There are certain rules that you can follow. The method I followed was, or I have given to patients, there is two choices. When they are losing weight, that is one thing that they're doing is, I started eating from 6 in the morning and I eat till 2 o'clock. I eat real butter, real sugar, everything pure real. I do not use any sweeteners. I do not use anything which is processed. I stay away from processed food. What I am able to do by that is I am eating from 6 in the morning and then I'm stopping my eating around 2 o'clock. At 2 o'clock, I eat a big lunch and I'm a happy camper. I have a piece of dark chocolate or milk chocolate, whatever I feel like. After 2 o'clock, I'm not going to eat. So gradually your body will get used to it. So in the beginning, what is going to happen is they are going to be causing the growth hormone receptors to go up. So we can have more breakdown of sugar. And that is the basis. That is what we want, the sugar to be broken. After the sugar gets broken, guess what? Adrenaline comes out. After growth hormone, adrenaline causes increased energy in patients with diabetes because the adrenaline thinks that we need to have sugar. So it increases the burning of the fat. As soon as fat starts burning, it's basically melting away everything. And that is the basis that we are following in diabetes. If you are following intermittent fasting and you cannot skip dinner, there is a method for that as well. What you need to do is you need to start your eating exactly, say you're going to start your eating at 2 p.m. or maybe say 1 p.m. You are going to eat 6 hours. So 1 to 7 p.m. you're going to eat. You're going to have a good lunch. You're going to have a good dinner. And you are not going to eat anything till 1 o'clock the next morning. Now, this is something that I do not follow myself. I have always followed the 6 to 2. However, on the weekends, and I have social meetings or other things going on, I cannot just, say that I'm not going to go for dinner to somebody's house because I'm on a fasting. I cannot do that. So I have to be realistic about these goals. So on those days, so Monday to Friday, I follow a very, very strict regimen of 6 to 2. And then on Saturday and Sunday, if I do not have any social commitments, then I'll continue that. However, if I need to go to somewhere and I have a dinner plan, I start the fasting. But after I start the fasting later on. So basically what I do is, after I'm done with Friday's meal, and then I come home and I eat a little bit of a dinner, and then I do not eat till 1 p.m. the next day. I eat a very small dinner on Friday, and then the following day I again start eating at lunch. I'll eat a small lunch and I will wait for going to dinner and eating. I will not overeat, but I will also eat healthy food. I'll have lots of fruits, vegetables. I will have fish. Fish is something which I love. But what it does is, it is causing the breakdown of fat in the liver. Once we are breaking down the fat, insulin resistance goes away, diabetes goes away. It's the chronic disease state of high insulin level. So please take a moment and think about this, that all we are doing right now is not what we want to do. We are treating the symptom, which is blood sugar. We are not treating the cause of the disease, which is the high insulin state. Once you start intermittent fasting, gradually you're going to get the hang of it. Right now, I'm not in the weight loss mode. I took myself off of the weight loss mode for a few months. I decided that I'm going to do intermittent fasting still, but I'm not going to do it in the same way I was doing before. So what I do is, I eat from 7 to 2 from Monday to Friday, and then I'll probably do a breakfast in the morning on Saturday, and then a dinner on Saturday, or I change or however I want. However, when I am in the weight loss mode, I follow the rule. When you are making the body fast, actually right then, the body's own mechanism, the way the growth hormone is released, the adrenal is released, is going to give you a lot of energy as well. My next topic of discussion is going to be tackling on intermittent fasting, obesity and diabetes. So how are we going to be realistic about the goals that we set for ourselves? So it's not that you're going to think, I need to lose 100 pounds. No. Take small goals, 5% body weight. When I started my weight loss journey, I was 187.5 pounds. I took 10% body weight, which is 18 pounds. So you need to take small goals and reach there. We now have a lot of diabetic medication which are catered towards bringing down the insulin resistance. Not as much as intermittent fasting does, but it still does a great job. Talk to your doctors about the various medications, and in my next few topics of discussion, I'll be breaking down the treatment of diabetes gradually, the symptoms of diabetes. But today I really wanted to take a moment to engrave in your mind that please, even if you are fasting for a few hours, give your body a break. You'll be fine. This has been checked out. This has been documented in the journal, in various journals around the world. Intermittent fasting works. That is the only way you can defeat diabetes. We have to defeat diabetes by intermittent fasting. You can do a keto diet, but at the end of the day, as soon as you start eating normal, you are going to gain back the weight. Not only that, the keto diet still has fat and proteins in it. So the fat breakdown is not as drastic as intermittent fasting. On intermittent fasting, you can lose 10 pounds in a week. The first week you're going to lose like 10 pounds because your body is on fire. It's like I need to get the sugar cells some sugar, so they are breaking down fats. As soon as we can break down fats, we have conquered the disease. So I hope you enjoyed this presentation. If you like the presentation, please comment below. And on my next topic of discussion will be how to tackle intermittent fasting, how to tackle our cravings, what are we going to do, how to make intermittent fasting smoother, easier, and I think you're going to be able to conquer the disease. Please drop a like and a comment below if you like this topic, and if you want me to continue on the education of diabetes from a person who has been treating diabetes for more than 20 years now. Hopefully you guys are going to have a great weekend ahead, and speak to you guys soon.